Dr. Harper, welcome to the Daily Social Distancing Show.
Thank you. It's a pleasure to be here.
Let's start with congratulating you on your success. You are now not just Dr. Harper, you also Dr. Harper, New York Times bestselling author. How does it feel?
It feels amazing. It's surreal. I'm still getting used to it. But it's lovely. Thank you.
I think what I appreciate about it the most is the fact that it's not just that you're a best-selling author, it's that it's a book that deserves to be read. Tell me a little bit about what it's been like being a doctor on the front lines of the worst pandemic, arguably, that humankind has ever seen.
And so I'm in New Jersey. That's where I practice clinically. So it's been a little bit of a roller coaster. I mean, 6 weeks ago maybe it was what we're seeing in the South, where there's a deluge of patients. We don't have enough equipment. We still don't have enough equipment. We don't have enough staff. People were getting sick. It was not only us getting sick and the patients getting sick, but I was taking care of healthcare providers from my region and other regions, like the technician who came in and he kept apologizing because he was feeling terrible. He couldn't breathe. His resting heart rate was high. His resting oxygen was low. And he's apologizing because his phone is blowing up because his boss is calling him, telling him to get back to work. And they know he's sick. They're all getting sick, but they don't know what to do because they can't staff the unit. And of course, he can't go back because I have to admit him back to the hospital. So that's what we went through. And now there's a little bit of a lull, thank goodness, in the Northeast, but we're bracing because we see what's going on. We all feel it will come back.
Another thing that's really opened my eyes has been your writing, not just in the book, but in the posts that you've put out about the effect on healthcare workers. And one thing I found really interesting was where you said a lot of us, meaning healthcare workers, don't know if we'll come back to this profession once this is all done. Tell me why there is that sentiment in a lot of the medical community, because I'm seeing this from many healthcare workers who go, I don't know that this is for me. I don't know that I want to be a part of this. Why? What, other than the coronavirus itself, what is driving this feeling?
There is a lot of stress. And when I mention that we feel we're treated as more disposable than our equipment, that's a real thing. It's a strange thing to be called a hero. Yet I don't believe heroes are put in a position where they don't have the equipment that they need, when they don't have the staffing and departments that they need, when their hours are being cut, their pay is being cut. Because in healthcare, in America, healthcare is, for the most part, like any other private industries, and it's based on profit for a few. That's very demoralizing, and those are the conditions we're working in. Um, And then, of course, I work with many people who they have families. I know many healthcare providers, what everyone's saying is true. I know many healthcare providers who don't go home. They're staying in hotels. They're staying with a single friend where they can be in a basement apartment. So their whole lives are being turned upside down in the midst of this.
You also talk extensively about the disparities between hospitals in underserved communities, in poorer communities, and communities of color versus hospitals in wealthier or affluent neighborhoods. That's been difficult for some people to understand because I've seen newspapers or people who choose and they go, I've been to this hospital, everything seems fine. And yet there are healthcare professionals saying yes, because the load is being unfairly borne by certain communities where there is a disproportionate amount of people getting extremely sick from this disease. What is it like working in a community hospital or a hospital in a community where people do not have the means and the hospital doesn't have the means?
What it's like is heartbreaking. I mean, I personally, I prefer to work in communities that are inner city, largely Black and brown, and lower resource financially, um, because I go where the need is. And so what I'm seeing is that the people being most affected are the essential workers. And we know that in these communities, essential workers are the people who are working in mail delivery, store clerks. These are people who can't not work. We need them to be working, and they can't afford to not work. They don't have the kind of jobs that they can perform from home. So they're at greatest risk. They're at greatest risk of infection, greatest risk of abuse. I mean, I took care of a young woman, maybe around 18 years old, 19 years old, who came in. because she didn't know if she wanted to live anymore. She already was pretty isolated, didn't have any support from family or friends. Now in further isolation from coronavirus, working in a job where the customers coming in were abusive to her, where she was being harassed by her boss, and she didn't know where else to go. She needed someone to talk to. And we just spoke, and I listened to her, and I told her that what she's feeling is real, and we're all feeling it. And I asked her if there was anything else we could do for her, if she felt like she needed to stay in the hospital. And she said, I just needed someone to talk to. There's no one to talk to. And you listen to me. And I feel like I can go on. And I'm seeing, and she was well, thank goodness, but I'm seeing a lot of that versus the mail delivery person who wasn't well and his whole department wasn't well and he was admitted to an intensive care unit. So those are the burdens I'm seeing, the burden of not having access to regular care, not having benefits, not having pay, and being forced to work under these stressful circumstances with long hours under they're not healthcare providers. They didn't sign up for this. They don't have the same training we do, and they don't have any equipment at all. So that's what I'm seeing. I also want to mention that, of course, I'm seeing nursing home patients being affected more, but also the prisoners. And this is particularly heinous to me because they can't make their own decisions. They can't say, guess what, today I want to go to the emergency department. And I've seen so many of them when they come in and they can't breathe and they're just about to be intubated, or maybe we can stave it off with other therapies, and they're terrified. And many of them were young and healthy. And they tell me over and over again how they wanted to come in, but they were told in the prison they had to wait when they got around to it, when the next vehicle was ready to take them, and it could be days. So those are some of the disparities that COVID is really laying bare for us all to reckon with.
Well, I'll tell you this, Doc. If I could wave a magic wand, everyone would read your book, especially the people who don't think this is real or don't, take it as seriously as they should. Thank you so much for your time, and thank you for the work that you're doing in the hospitals every single day.
Thank you. It was a pleasure being here.
Pleasure was mine. Thank you, Dr. Harper.